Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. November is National Hospice and Palliative Care Month. In 1967, Dame Cicely Saunders, a physician in England, established the first modern hospice. That philosophy of end-of-the-life care continued to spread around the world, and in the United States, the first hospice was established in the 1970s. What is hospice? What is palliative care? Who is eligible for hospice services? Senior Connection Center works with several hospice organizations in our 5-county area. One of those organizations is Tidewell Hospice. Here today to help us answer some of the questions about hospice is Molly Thomas, Community Relations Representative with Tidewell Hospice. Also joining us today is Bardine Hicks, Outreach Coordinator with Senior Connection Center. Thank you both for joining me today.
Thank you for having us.
Glad to be here. Thank you.
Although there are hospice houses, hospice is not a place. Molly, would you explain to us exactly what hospice is?
I would be happy to, Patricia. You're absolutely correct. Hospice is not a place. It is a philosophy, and it is a philosophy that includes comfort, care, and compassion for individuals who have been diagnosed with an advanced illness. And that place can be where we come to you to provide that care, and that compassion could be in your home. It could be in a assisted living facility or a long-term care facility or a hospital or wherever the patient may be that is in need of our services.
Is there a difference between hospice care and palliative care?
There's absolutely a difference between palliative care and hospice care. Palliative care, of course, is when an individual is receiving symptom management as well as pain management. And they can be receiving that palliative care during the time that they're also seeking a curative care for the illness that they've been diagnosed with. Now, hospice care is when you are also receiving palliative care as far as pain management is concerned, but you're no longer seeking curative care. To explain that a little bit further, all hospice care is palliative care, but not all palliative care is hospice care.
Bardine, you've joined us today because your family was a recipient of hospice services. Can you tell us a little bit more about that experience?
We received exactly as Molly explained, care for mom for symptomatic as well as pain management, and it was so helpful. It helped us to understand how to provide the care and comfort she needed at home, understanding the symptoms of, her chronic conditions, actually really helped to alleviate a lot of stress. And then receiving, the care at home with the, healthcare professionals who were always so willing to educate you, answer your questions. And we received comfort as well during that time.
Thank you for sharing that.
Absolutely.
Molly, what types of services are provided through hospice, specifically through Tidewell Hospice?
Thank you, Patricia, for asking that question. When an individual and their family decide to use hospice, Tidewell Hospice there is a whole team of people that are assigned to that patient as well as their family. And it's a team of experts, the doctor, the registered nurse, we have a CNA, we have a dietitian, we have a chaplain, a social worker, and all these people are working together to make sure that the patient is receiving the services that he or she may need. And we're not just there, as I said, for the patient, but we encompass the whole family. As Bardine said, when hospice came in to provide services for her mother, that the hospice services did not just encompass her mother, but it also encompassed the whole family to make sure that the family understood what was happening with their mother and how she was being cared for.
Bardine, what types of services were provided to your family through hospice?
There, for the team Mom was assigned with, there was a doctor who came quarterly. There was a nurse who would come as often as you needed. We had a couple of days out of the week. However, if the symptoms, weren't manageable, she wasn't feeling well, I could always call a 24/7 line, and the nurse would come out to see her. And it was no matter the day or the hour, which was so helpful. That prevented from having to rush to the emergency room. And also it provided comfort for, me as well as the caregiver. And then we also had a social worker who was very helpful. There was also a chaplain, and then there was also the pharmacist that when medications were prescribed, the pharmacist would talk to you to inform you what medications were going to be delivered, how to use them, also like that emergency kit, how to store it properly, and how to use it when necessary. And all of that was so very helpful.
Molly, who is eligible for hospice services?
Thank you for that question, Patricia. Anyone who has been diagnosed with an advanced illness of 6 months or less is eligible for hospice services.
How does someone pay for hospice services?
Well, hospice services is covered under Medicare and private insurance. And under Medicare, the patient is allowed 180 days of hospice services.
What if someone doesn't have Medicare or their private insurance policy does not cover hospice services?
Sure. Tidewell Hospice is a non-for-profit agency, and because of our generous donors, we are able to not turn anyone away who needs our services, whether their inability to pay or not. They're never turned away.
And I would say that that's true for most hospice organizations. Molly, why is there such a reluctance to use hospice services or to delay the use of hospice services?
Patricia, I think that that's due to a lack of understanding. I also believe that it's due to a lack of fear. People don't want to feel as if that they've given up on their loved one and that they've turned them over to hospice. For those people who are not aware of what hospice really is, in their mind, they could be thinking that they're turning their loved one over to a philosophy that says that their loved one is just going to die and that there's nothing else that can be done about that, when it's so much more than that. It's as I said in the beginning, Hospice is not a place, it's a philosophy. And that philosophy is to provide care, comfort, and compassion for individuals and their families who are walking with their loved ones down that last quarter of life. And we do that by providing that care, that comfort, and compassion, which will allow family members to have some memorable memories of their loved ones as they're walking down that last quarter of life.
Bardine, what would you say to someone who is reluctant to find out about hospice services or to use hospice services?
I would encourage them to learn, of course, more about what services are provided, and to see how at that point, as Molly pointed out, the quality of life at that point is more important than focusing on the quantity. And we had the opportunity to do that. And in doing so, I believe that we gained a little bit more time because of the healthcare professionals, the supplies that were provided, delivered to the home, the medications, and then when the time came where we needed a CNA, that was so helpful. Took away a lot of stress, and it provided time for the caregiver, have a little respite, which is so necessary. And it's an uncertain time. So to have professionals that can walk you through that process, it can give you a lot of comfort when you are prepared for what is ahead, rather than just being left alone, trying to figure it out on your own. Your loved one in and out, of the hospital, and there's nothing they can do for them, where they could be at home in the comfort of their own home, receiving the utmost quality, professional, compassionate care that anyone can receive. I highly recommend it.
Thank you for sharing that, Bardine. And as someone who has received hospice services for our family in the past, I also second everything Bardine said. It is a wonderful service that cares for the patient and the family. Molly, how has COVID-19 impacted hospice services?
Yes, and we all know that COVID-19 has impacted a lot of businesses and agencies in how they do and conduct businesses, as well as Tidewell. Tidewell, we are the safety of our patients, their families, and of course our staff is of the utmost importance. Making sure that we have the PPE equipment and materials that is needed in order to keep not only our staff, but our patients and their family safe is the utmost importance for Tidewell. So because of that, our volunteers that we have are no longer volunteering at this particular time. So that's something that we have cut back on. Mm-hmm. And that is to protect them as well as, their safety and their family as well. So Our services, however, that we provide for our patients and for the families and our community, those services have not changed. We are still providing the utmost quality service of love and compassion to our patients and to their families that we have in the last 40 years. That has not changed, and that will not change.
Such good information. We're coming to the end of our interview. Bardine, final thoughts for us?
I'm so thankful for hospice care. The people who, the healthcare professionals that provide the services, they are really exceptionally special people. And you have to have people that are caring and it's just unbelievable of how selfless the workers are. And I'm just thankful, that we have services such as hospice that's available for uncertain times. So to all hospice workers, I thank you. God bless you.
Molly, final thoughts for us?
Yes, I wanted to say thank you, Patricia, to you and to Senior Connection Center for giving not only Tidewell this platform to talk about hospice and keeping in with Hospice Month, to talk about something that few people really want to talk about until they find themselves in the midst of needing the services. And I always say it's difficult to make an informed decision if you don't have all the information to do so.
Right.
So I want to thank you and thank Senior Connection Center for giving us this opportunity to heighten our community and the public awareness of exactly what hospice is all about and what hospice is not. Hospice is actually more than what you think.
Such great information on such an important topic. Thank you both for being here today.
Thank you for having me.
Thank you, Patricia. It was a great interview as well.
We will have information at the end of the video on Tidewell Hospice and other hospice organizations in our area, as well as how to find a hospice organization in your community. I'm Patricia Henderson, and this is your Weekly Connection.